Thank you, Mr. Speaker. I stand here in support of SB 188, and I would like to thank Senator Max Wise for this piece of legislation. We have worked together on several pieces of legislation, and I appreciate his passion for the pharmacy profession. Many of you in this body will remember Senate Bill 50, which basically set out a few fair trade rules for a single PBM in the state of Kentucky. The PBM reform bill only applied to state Medicaid, but it saved Kentucky taxpayers hundreds of millions of dollars. Many of us will remember PB Reform Bill HB 457 a session or two ago that overwhelmingly passed this body. SB 188 is carrying on the work that must be done on behalf of our consumers, our patients, our employers, and our independent pharmacy. I have worked on this process since 1995. Senate Bill 188 is an act relating to PBM reform. For those of you who do not know what PBM stands for, it means Pharmacy Benefit Manager. PBMs have gone unregulated completely for decades. This bill addresses many of the egregious actions that PBMs have taken against Kentucky employers, taxpayers, consumers, and our local independent pharmacies. When it comes right down to it, this bill is about providing health care in many of our rural communities, and this bill is worthy of all our constituents. Over the 50 years I've been a licensed pharmacist, I have seen the professional role we play in our communities expand enormously. When I first started, you couldn't even put the name on the label. Local pharmacists play a fundamental role in improving public health. They are often more accessible and more approachable because they are involved in their communities and in the lives of the patients they serve. Your community pharmacist does life with you. He sponsors your Little League baseball team. He's the one that buys the cakes and cupcakes at your bake sales and attends church with you. We counsel patients, dispense much-needed medication, and give immunizations. In recent years, we now are testing for flu, strep, COVID, and UTIs and much more. When I was a pharmacist in 1995, I even did cholesterol checks, and I was CLIA waived. We work in tandem with the doctors and health departments, employers, and consumers to make sure our loved ones are taken care of. While the role of pharmacists in healthcare has grown and continues to be vital, the reimbursement for their services have hit an all-time low. I can remember in 1997 getting paid $1.50 for filling a $1,000 prescription. There's not a bank in the country that handles $1,000 for $1.50. Pharmacists will continue to serve our patients and expand our services because that is who we are as a profession. The problem with that is unregulated PBMs took control and took advantage of our loyalty to our patients. The big pharmacy chains have vertically integrated together with the PBMs and big insurance called vertical integration. This bill is needed because at the present time, the companies that write insurance for all our employers, the pharmacies that fill the prescriptions, and the PBM that processes those prescriptions many times is the same company, vertical integration. PBMs say they are saving us money. I would ask you, have you noticed drug spending going down? Have you noticed insurance premiums going down? Have you noticed that consumers are paying less of the cost of the medicine at the cash register? Of course not. We are all paying enormous costs for our medicines, and PBMs are at the core of the problem. This is why other states, such as Tennessee and West Virginia, have passed PBM reform. And the Federal Trade Commission is investigating PBMs nationally. Both presidential administrations, Republican and Democrat, have called out to PBMs for unfair trade practices. Mark Cuban talked about PBMs the other day. And our own Governor Beshear talked about SB 50 at the White House Roundtable on lowering health care costs. Members of this body, in the last 2 years, over 68 independent pharmacies have closed their doors or sold out to chain pharmacies because they're not able to keep their doors open and serve their community. In Somerset, there were 10. In Bowling Green, 3 in the last 3 months. And here in the last couple of weeks, 1 in Richmond. Pharmacists are asked to do more and more, and the PBM reimbursement is less and less without any regulation. PBMs forced our independent drugstores to take it or leave it. What a mandate. Contracts, and then proceeded to direct consumers to their own out-of-state mail-order pharmacies. SB 188 is much needed and will level the playing field between PBMs and other stakeholders in healthcare, including independent pharmacy. One might ask, why is this necessary? I want to remind us all about this. It's all about healthcare. It's all about healthcare. This is not about technology. This is not about paper goods. This is not about automobiles. This is about access to healthcare for your rural communities. Finally, Senate Bill 188. I'm sorry, I've turned 2 pages, which I've done before on this floor. Yeah. So what does SB 188 do? It will not allow PBMs to mandate Kentuckians to receive their prescriptions by mail. It remains an option to them, just doesn't mandate getting prescriptions in the mail by a pharmacy located out of the state that is owned by the PBM many times. Second, PBMs will not be allowed to reimburse a pharmacy they own at a higher rate than a community pharmacy they don't own. Third, PBMs simply won't be allowed to steer Kentuckians to a pharmacy they own, no matter the consequences to patient care. No more profits over patient care. Fourth, they cannot require a Kentuckian to pay a higher copay at a community pharmacy than they would pay at a pharmacy owned by the PBM, hereby creating improper incentives. And fifth, PBMs will no longer be able to penalize a community pharmacy for telling our patients that they can buy some medications cheaper without using their insurance. Yes, this is forbidden, and we can currently be shut out of insurance plans if we share such information with our patients. We should be able to share with our patients the cheapest way to buy a prescription. Finally, Senate Bill 188 would also require a PBM to direct the Department of Insurance to determine a cost of dispensing fee that will be used moving forward by PBMs when reimbursing pharmacy their costs to dispense medication. Realizing this study will take the Department of Insurance some time to complete, this bill uses the Medicaid dispensing rate just for the time being until the study is completed. Independent pharmacy cannot wait. It will be too late for many of them at the rate they are closing. When the Department of Insurance completes the study and establishes a new dispensing rate, the Medicaid dispensing rate will end in perpetuity, and the new dispensing fee will apply to all retail pharmacy in Kentucky. This bill does not apply to Medicare Part D, a federal program, or to Medicaid. We did that in Senate Bill 50 when we addressed that. This bill applies to all PBMs who service our commercial insurance customers. This bill also avoids any conflict with the URSA law, as the contents of this bill will be preempted by federal law if indeed there is a conflict. It's already been tried in Arkansas and Oklahoma and declared constitutional. I have reviewed this bill, and while it doesn't fix the entire health care system, it continues to keep Kentucky on the forefront of PBM reform, and I kindly ask for your vote. And Mr. Speaker, I move for passage of SB 188.